Okay. So hello, my name is Alina. I'm going to be doing the policy analysis presentation. It's only going to be me because when we made the groups, I wasn't here. So Hannah already did hers with Andrea and Ash Ashley. So it's just going to be me because she volunteered to help me. Okay. Oh, share my screen. Can you see my screen? Okay, so today I'm going to be talking about reproductive health, understanding and promoting well-being. Um, what is reproductive health? Next slide. Oh no. Oh, there it goes. Reproductive health is a state of complete physical, mental, and social well-being related to the reproductive system. I forgot to mention that I'm doing this policy towards a legislator because a woman's reproductive health has been a topic of for many years. So I want them to hear this presentation. Key components of reproductive health, family planning, contraception, informed choice, anatomy of childbearing decisions. So women have always been told what to do with their bodies. You never tell a man what to do with his body, and then why are we telling women what to do with their bodies? We they're unable to get certain health care because of, say, they want to get an abortion. They can't get it because we something called Roe versus Wade was overturned. So a lot of states aren't offering that anymore of an accessible abortions. So they're having to travel to far states, far miles, and you just to be able to get a abortion. Maternal health, prenatal delivery, postnatal care, safe motherhood. When a woman does give birth, their body goes through a lot of changes. I have two kids, so I know how that is. And being able for a woman to be able to get those right accessible care from postpartum care because, women go through postpartum depression, postpartum anxiety. So being able to get the care that they deserve and need is good for them. Sexual health, safe consensual relationships, anatomy addressing violence. There are many women, also um, some women get raped, and also because of this, they get pregnant, and then they want an abortion, but can't get an abortion close by because states are banning them, and nobody will perform one for them. STI prevention, screening, treatment, vaccination, education. So just um, um, informing our children, informing teenagers about safe sex and all that. Safe abortion care, legal safe abortion services, post-abortion support. As stated before, women have to travel far just to get an abortion, and that's unfair to them. They shouldn't have to carry a baby that they essentially don't want or feel comfortable enough to have yet because they're not ready. Education and empowerment, sexuality education, gender equality, and reproductive rights awareness. Gender equality, as stated before, we tell women what to do with their body, but we don't tell men what to do with their body. So being able to not tell anybody what to do with their body, neither women or men. And then populations that are mostly affected by this are low-income women. They often lack insurance or face high out-of-pocket costs, making it preventable to receive care. Healthcare can be very expensive. I know after I had both my kids, I got a hospital bill and it was not pretty. So just I know a lot of people, they think about that stuff. They're like, I can't afford to pay that hospital bill. So therefore they don't want to have those. um, barriers. Women of color, especially Black and indigenous women, face disproportionately high maternal motor, motor, mortality rates due to systematic care. I've heard many stories about women not being treated fairly because of the color of their skin. I actually recently saw a TikTok where a woman she was pregnant. She was about, I believe she was 35 weeks pregnant, and she had went to the urgent care emergency room. And there was a nurse there who was just, are you in pain? Are you this? Are you that? But she was clearly in labor and needed to go up to the maternity ward, and she just had her sitting in a chair waiting. So these women are highly, um, they are, what's the word I'm trying to find? They're not treated with the same respect, as a white woman, you would say. Um, Those in rural areas, there's fewer hospitals, clinics, and specialties, particularly in women's health and maternal care. Women who live in places that are like in the middle of nowhere, you don't see many hospitals around. Over here, we have Loma Linda, we have Riverside, there's Arrowhead, so there's many different hospitals for women to go to if they need anything. Oh, back. And Roe versus Wade. So this is pertaining to abortions. This is a Supreme Court decision that was established in 1973, which gave women right to abortion and right to privacy under the 14th Amendment. This ruling was overturned in 2022, ending the federal constitution of right to abortion. And resulting in this is where women are traveling to far states just to get an abortion. And but this was very dangerous for them because some women couldn't get an abortion, so they were trying to find ways, to essentially not have a baby. So they were hurting themselves, doing something, and this increased probably more mortality rates in women because they didn't want a baby, so they were doing stuff to prevent that. Um, Title X, this is 1970 under the Public Health Service Act. So this is it ensures access to comprehensive family planning and preventative health services for those who can't afford them. Services covered would be contraception, pregnancy test and counseling, STI testing, cancer screenings like pap smears, and I believe woman needs a pap smear every 3 years, if I'm not mistaken, every 1 year. Health and education referrals. So the Title X program, I didn't even know about the Title X program until I was doing research on this paper, and I found it to be very informative. I included a little graph of the clinics that still have the Title X program and clinics that are no longer in the Title X program. So many states still have the Title X program, which is really great for people. And then there's also Medicaid and Medicare. This was established in 1965 as part of the Social Security Amendment. The purpose was to provide health insurance coverage for low-income individuals and families. The eligibility varies by state, but generally includes children and parents, pregnant women, seniors, people with disabilities. I believe Medicaid is for seniors, and then Medicare is for the pregnant women and children and parents. And people with disabilities also Medicaid. Coverage, hospital and physician services, long-term care as nursing homes, preventative care, like immunizations and screenings, and then prescription drugs. My policy recommendations would be changing the current policy to better address reproductive rights. There shouldn't be any laws or regulations about what women should do with their body. There aren't any of those telling women, they need to get a vasectomy so they don't have any kids because men can reproduce children more faster than women. It takes a woman 9 months to get have a baby. Men could just go anywhere and have a baby with somebody. So being able to just not tell anybody what to do with their body and letting them choose as they please. Many women who become pregnant do not want to continue the pregnancy, but are afraid to ask for help because they're afraid of being judged. Women should be able to make their own choices about their bodies. They should not have to travel to other states to get proper abortion care. And Roe versus Wade should not have been overturned because since it was overturned, many states don't offer accessible abortions. My conclusion is women deserve more access to abortions, better access to health care and family planning, like Medicaid, Medicare, Title X, give women their own voice of what they want to do or what they want to do with their body. And then Roe versus Wade being put back into action and allowing women and allowing more doctors to be able to perform them. And that's it. And then there's my references. Thank you. Do you have any questions?
Thank you. Mhm. Yeah. Question about the cover with the you say about the example X program. Maybe I missed this. Okay, all this way, you're fine. Okay. I have a question about you said about the Title X program. Is this like a policy? Is that like a policy? Was that covered? Maybe I missed this point. So it's covered like for all women, like in and all ages, or
Yes, so the Title X program is for, oh, whoops. The
the
Title
Title
X
X
program
program
is
is
for
for
everybody, elders, women,
women,
men.
men.
It's
It's
just
just
essentially
essentially
giving
giving
them
them
better
better
access to
access
the
to the
family
family
planning
planning
and
and
better
better
health
health
care.
care. Mm-hmm, mm-hmm. And those the requirements for the access for this program?
That is a good question. I
I
did
did
not
not
look
look
that
that
up,
up. Okay.
but I
But
will
I will
get
get
back
back
to
to
you.
you. Okay, no problem. Yeah. And for the you said for the abortion, for the like actually for the specific age for teenagers, they have like the problem for the like being pregnant with this sensitive age. Do you think any like policies on any rights they can just keep them or just to protect them from like any problem in their future, or they have rights just to abort to for the abortion? You know what I mean?
Yeah, so I believe, that if say a teenager ends up getting pregnant and they do want an
Yeah.
abortion, I believe they should get that option. I do think they need their parents' consent, if I'm not mistaken, because they're underage, but I'm not too sure about that. But I believe, if that's what they essentially want to do, they should be able to get that access.
What about the schools programs? Maybe the school programs. Do they have like cover the title of
The
the
school
school?
programs, I'm not too sure. Before, I do know that they used to talk about, safe sex and all
Mm-hmm.
that. I don't know if they still do it. I haven't researched that. But
Mm-hmm.
I do know, I think if you go to like I knew if you go to like the school nurse, she will like give you like preventative options and talk to you about that stuff.
Yeah. Okay. That's it.
Okay.
Thank you.
Thank you.
Thank you for all the information. Yeah, you covered like new things, information for me. Yeah, thank you so much.
Of course.
Yeah.
Thank you.